Okay, so now I'm coming to step one out of 10 steps in the long frame approach. That's defining the problem. So there are seven sort of what I call minimal essential requirements for defining a public health challenge or problem. The things that you want to know about the group that you're supposedly going to be helping. One is the population, age, and sex structure. Like, do you live in a really, or are you trying to help a really old community on average? Are there more women? Are there more men? Things like that. What are the relevant morbidity or illness or mortality stats? What is the epidemiology and geographic distribution of the problem? What facilities are available to help and sustain the work? What is the available person power that you can bring to bear on the problem? What are the available training facilities and capacity? And then last but not least, beliefs and attitudes in the population that you're targeting toward health, disease, attitudes towards cures, attitudes towards prevention, and make sure that you don't assume that everybody shares the same set of beliefs and attitudes. Additionally to that, we have to look at what our constraints and limitations are going to be they technical, economic, social, or cultural. What are the existing solutions that people are already employing? Either to the problem that you're working on or something adjacent to it or relevant to it. And then what are your potential setbacks? So if we think about this with respect to our current, prevailing and very preoccupying health challenge, COVID-19, you can see, some of the considerations that you might want to have at the front of your mind when you're starting to think about these kinds of things. So the considerations are on the left, would be things like, what is the utility of the intervention in prevention or diagnosis or treatment, economic feasibility, durability, sustainability, ease of use for users, and adherence to quality and safety standards. On the right here are some metrics that you could use to help you understand some of these different considerations. Like, for instance, the utility of the intervention. How does it compare to the existing standard of care? For instance, in the testing scenario, COVID-19 testing scenario, do we want to have limited testing versus universal testing? What's going on there? And so building a chart like this that starts to help us put some thoughts on paper about what are the kinds of things I'm thinking about, and this left column can remain the same depending, typically this is a standard one that you can apply to a particular programmatic challenge or initiative that you're pursuing, and then you fill in the right column according to what's relevant. Again, we'll send out these slides because you can work through these if you want, but in the interest of time, I'll keep moving. Okay, so that's defining the problem. Step two is conducting a needs assessment. That's a critical piece. In the Public Health Training Center over here, we do offer other webinars that are all about other things that you have to do along the way. So we have webinars that are focused on developing the toolkit of doing research like this or a needs assessment like this, taught by one of my colleagues. So we could orient you to that at some point this morning or send out relevant material, all of which is at Emily's fingertips. But briefly, needs assessments. This helps you identify the issue and where and how resources are going to be best used. Identifies factors impacting health outcomes or health systems already. The needs assessment should be evidence-based and problem-focused, and data from the appropriate population or a subsample thereof can be collected through a variety of different means, surveys, questionnaires, focus groups, meetings with stakeholders, or personal observation and interviews. There are lots of different methods that are used to conduct needs assessments. And we can also collect information through a scrutiny of existing records like demographic data or vital stats, hospital records and literature reviews and things like that. There are questions about how you sample or subsample a population, which are relevant, which ask us things like, are we going to randomly sample or purposively sample? Will we have a stratified sample? And what effect size are we aiming for? And what would our contact method be? Now, these are some needs assessment considerations that I think are good to just review here. For the purposes of this webinar, we don't have time to kind of work that particular process, but like I said before, we do have other trainings that are focused on this kind of thing, research design and data collection. So, but these are some of the things that should be front of mind for those of you who are at the needs assessment stage. And the great thing is that there's, you don't have time to attend a webinar right now on this, or there isn't one happening at a convenient time in your program planning cycle. There's a lot of information about doing this on CDC and tons of stuff on YouTube and things like that. Now we're going to go back to the mission statement, and here there are a couple of considerations. First, you want to draw the attention of your clients and colleagues and potential funders. So a mission statement, in addition to being short, 2 to 3 sentences, like I said before, it should be grabby. It should make your listener want to know more. And that's really important for those of us who are regularly working with elected officials in our area, or maybe convincing, like for instance, our county commissioner, that the work is important and that they should buy into it. You want to develop a mission statement that's going to be grabby and that won't make people's eyes glaze over right away. Like I said before, I like to think of it as an elevator speech kind of a length. It narrows the focus, and it should be precise. So you don't want to say something like, I want to eliminate diarrheal disease. Instead, you should say something like much more concrete, like I want to reduce diarrheal disease in Ward 1 of the village from 80% of household members afflicted to afflicted at least once monthly to 20%. That's my goal. And if I were hearing that, I would say, my next question would be, that's really interesting. How are you going to achieve that goal? That's a great goal. And that's partly because I'm really fascinated by diarrheal disease interventions. But what I'm saying is, I think that, you phrase a mission statement in a way that does a couple of things. Doesn't just describe the program, it catches the attention of your listener. So for instance, a mission statement having to do with our COVID-19 testing model or example could be something like, you might want to start by saying, expanding COVID-19 testing allows infected people to know that they should avoid social contact as well as contact tracing. And this allows a more precise and cost-saving strategy than long-term social distancing or stay-at-home orders, something like that. So, as an example. Okay, steps 4 and 5 are the last things that I'm going to talk about just now before our poll. And now I'm running slightly behind. So sorry if we're not matching up exactly with the agenda, but we will finish on time, I promise. Okay, identifying stakeholders and understanding their perspectives. So potential partners, or engaging with them, or partners or stakeholders, would be like community organizations. In our case, in Montana, state of Montana, a lot of states around the region, that would include state, tribal, county, and local governments, educational institutions that can help support us. And like, for instance, at the University of Montana, we have data and modeling expertise and intervention science expertise that can really advance your work. And I would really encourage you to reach out to us in the School of Public Health, because we have resources here that can be, I think, quite helpful. Also, healthcare, obviously, like health education centers, health advocacy groups, and fitness centers. And having community support is, I think it goes without saying, absolutely essential. We can rely on our partners in the community, if they buy in, to the work. They can serve in an advisory capacity or champion specific areas to the people that they influence. They offer expertise and insight. By having stakeholders in the community, it is a demonstration of transparency. It is also a demonstration that you're committed to sharing information, and any kind of like materials that you develop or data that you collect or evaluation results that you generate can be shared with, or should be shared with, stakeholders or partners. And by doing so, it's trust building and rapport building. And so that's always a good thing. Also, actively participating in establishing an action plan by stakeholders is great, because you get people to help you, and that helps them buy in. And you know, there's abundant research and evidence out there that these things do advance programs toward reaching their initiatives. And then it can help share responsibility for some of the lift that has to happen in executing a program. And it ensures cultural relevance, so important in many communities, and helps stakeholders agree with and understand their roles and expectations of them. And people can be expected to participate if they agree to be partners or be supporters. They can involve themselves in a whole variety of ways in the work, which are listed here. Oops. I somehow duplicated my slide. I'm sorry. So, okay, step 5, the last one I'll do before our first little poll, and then we're gonna break into breakout rooms, and then we'll take a 10-minute break after the discussion. Or maybe I should flip that. I might have, after I do the stakeholder analysis, I might have a break, and then we'll come back. Sorry, we'll do a poll, and then we'll break, and then we'll come back for a discussion. That sounds good to me, and maybe to other people who need to use the bathroom. So, okay, stakeholder analysis. This gets us thinking about our stakeholders critically, compassionately, and strategically. So who is affected positively and negatively by our project? Who has the power to make our project succeed or fail? Who makes the decisions about money, the flow of money in, the flow of money out? Who are the suppliers of different components that the project has that are going to be important to execute it? Who are the end users of the program's parts, the trainings or products or what have you? Then who has influence over our stakeholders themselves? Who could solve potential problems with the project? Who is in charge of assigning or procuring resources or facilities? And then who has specialist skills which are crucial to the project? Types of stakeholders that you might consider in your work and the community that you work in would be the end users of the project's outputs, like, you know, the people who would maybe eventually use your, you know, physical activity program, or maybe, you know, receive a vaccine or use the latrine that you built. We don't do a lot of latrine building in this country, but we certainly do in other countries, etc. So who are the people that are going to use the products? Other kinds of stakeholders would be those from governance. So management boards, auditors, regulators, health and safety executives, etc. We have your influencers. Those are people who have the ability to change the direction of a project or program, like local newspapers, local unions, local opinion leaders, religious leaders, tribal council members, etc. Then you have your providers, and that's pretty much anybody who provides services, resources, or other critical needs to the project or program. So a stakeholder is basically any individual, group, or organization or community that's got an interest in the outcome And the analysis is to identify things about them that you are going to want to have at the front of your mind and, you know, acknowledged with your team members. What are the needs and interests of these people? And how do you work with what your stakeholders' needs are so that everybody wins, or at least everybody has a small win? The analysis also identifies who should be encouraged to participate and specifically at what stage of the project, any potential risks that could put the program itself at risk that different kinds of stakeholders could bring in. Like, for instance, you might find it important to have a particular kind of opinion leader on board, but maybe that opinion leader isn't as influential in all segments of the community as you wish they would be. Or even maybe some people in the community are against that community leader or opinion leader. These are some of the risks that it's important to just acknowledge and think about how you want to manage going forward. And then what sorts of opportunities do they bring in implementing a program? So for instance, if we look again at our COVID-19 testing example, some stakeholder analysis would be along the lines of, you know, looking at relative amounts of power and relative amounts of interest. We have the public, we have politically powerful decision makers, we have DPHHS. So all of these kinds of players would be playing a role. For instance, these are some, not all, in a stakeholder analysis of a COVID-19 testing program. And not all of them wield the same amount of power. Not all of them have the same amount of interest. And it's good to think through these things at the start. Okay, so I'm going to pause now for questions, and then we would do our first poll. And everybody will please fill in the poll and then keep it in mind, because then we will break for 10 minutes. People can use the bathroom or what have you. So the question in the poll is, who would you expect your community's most important stakeholders in community health to be? So please pick the top 3, so you can pick more than one. So pick the top 3 in your community and try and think of a specific program that you have in mind, like maybe tobacco cessation, maybe it's, you know, COVID vaccine, COVID testing, don't know what's on the front of your mind right now, or maybe a program that you're thinking of planning. But who would the top 3 stakeholders be? Okay, so the poll showed that the majority of you selected community members, your local health department staff, and then the providers or local health practitioners. That's really interesting. And then you can see like your county commissioner, other local elected officials, or other opinion leaders less likely to be chosen, but still chosen. Interesting. So let's circulate between the breakout room discussions, and if you guys could just share back what it was that came out of your conversation, I think the rest of the group would benefit. So Emily, could you help me by, I couldn't see who was in each group.
Yeah, so if you guys didn't notice, so room 1 had Colin, Melinda, Silvana, Taylor, and Trina. So if any of you want to speak.
Hi, this is Colin. We talked about some of the stakeholders that we had selected, and I think in general there was a consensus of kind of the same ones the group had selected, except for county commissioner, which Melinda brought up, which was a good point in her personal experience when working with public health. The county commissioner has been more influential.
And you're up in Lewis and Clark County?
I am, yes. Lewis and Clark County here in Helena.
Yep, okay.
DPHHS. And then Silvana had mentioned that she actually had other stakeholders that weren't included on that list, some federal partners and things like that. So I thought that was interesting.
Oh yeah. And what came up with regard to the county commissioner?
If you want, I can just answer. I found that the health department's decisions were affected by the county commission.
Yep.
So I think a lot of members of the public thought it was the health department that was the key stakeholder, but you could see behind the scenes the influence of the commission on those decisions.
Interesting.
And somebody else in our group mentioned that the county commission has to sign off on all agreements and contracts.
Yes.
So I'm not sure people always understand the direct relationship between the commission and the health department.
Just making notes. Melinda, thank you. That's really interesting. And in our state, as you guys know very well, this is really relevant right now, having to do with the bill before the legislature about who has power, if it's the health officers, if it's elected officials, et cetera. So this is really very much, a friend of mine for a lot of Montanans right now. I'm not sure how it is. We have folks from other states on this call, so not sure how that looks in your locality, but yeah, definitely something we're thinking a lot about right now in our state. Thank you guys. Room 2, who was in that room, and did you guys select a person to speak for the group?
This included Leslie, Marcia, and Patricia, or Marcia.
Yeah, it just ended up being the two of us, actually. And to be honest, we were comparing notes on programs because of being in 2 different states. I was very interested to know what she was doing. So we didn't quite get to the question, but we learned a lot about, I think, each other's programs in the brief period of time that we could.
Leslie didn't follow instructions.
I'm sorry. I usually try to. I'll do better.
No worries.
Can you tell us really quick what you guys are working on?
I oversee our state home visiting program here with the Department of Public Health and Human Services. So that's the federal maternal, infant, and early childhood home visiting.
Yep.
And so we were comparing some of the tobacco settlement because we get some of those funds for evidence-based, and Marcia or Marcia, I'm sorry, I'm not sure how to say your name, works with tobacco programs in California. So that was where we were discussing.
Interesting. And Marcia, do you pronounce your name Marcia or Marcia?
Marcia.
Marcia, yeah. And so you're California based? Yeah. And then Leslie, where are you?
I'm in Helena.
Okay, so you're doing all right with the communities around Lewis and Clark County.
Well, my lens is the state.
I see. Okay.
But yeah. I'm a resident of Helena, Montana. So
I see. Okay. And Marcia, where in California are you? Are you in an urban or a rural setting?
Urban.
You are.
In
Yeah.
San Francisco.
Oh, you are. Okay.
Yeah. Mm-hmm.
Okay. Good to know. Huh. You must have a lot of interesting stakeholders that you would have brought into that conversation. Had you guys had time to get to that part, but thanks for sharing what programs you're working on. That will inform my remarks going forward. And okay, what about group 3, room 3?
Was Erica, Ethan, Joshua, and Molly.
Who is your elected speaker? Ethan, I see you smiling. It must have been you.
We're gonna make Ethan do it.
I don't know if we really had one, but we just kind of talked about the results of the poll and how everybody had really similar answers. And then we kind of did just some basic discussion on different projects we are working on and how this is relevant for that. And just, we kind of have some different perspectives within the group. So yeah, I don't know that we specifically talked about the questions, but we did kind of get into, the importance of stakeholders from each of our different perspectives. So we kind of got there in a roundabout way.
And I know that you work a lot on COVID. What other programs were represented in your conversation?
If others want to speak up, there are a couple of us from UM, kind of looking from myself from a research perspective. And then, I do work some on COVID and then more with air pollution too, and that type of research perspective. And then,
That's right. Yeah.
so yeah, there were a few different perspectives represented in our group, I guess.
Mhm. Josh, I noticed that you had indicated Lake County in the chat box. Is that where your position is? I always make the mistake of thinking you as a UM person, but then I realized when I read your comment that that's
Oh,
really
I try and keep it simple and adhere to what I was asked to do.
yeah.
I'm still at U of M, so working on my PhD and my master's. I graduate with a master's this summer. I mean, this
Yeah.
spring, sorry.
Yeah. Yep. And up in Lake County. And then Molly and Erica, where are you guys from? Can't remember from the chat box.
I'm in Missoula,
Ah, okay.
doing teen dating violence and sexual violence prevention.
Oh, excellent.
Yeah, one thing that I thought was a good point that Erica actually brought up was, you know, a lot of folks mentioned that community is important. It's important to get community input, but how often do we actually really see community input? And I just mentioned that, you know, I tend to see that as well. We tend to say we want people's opinions from the community, but there might be a practical issue with trying to seek out that input at times. And so we tend to not really seek out input from the community that much, even though we say we prioritize it.
What are some of those practical impediments?
Time, expense.
Yeah.
Just the craziness of dealing with the analysis of the data.
Sure.
So I mentioned a couple of years ago, like I got to be a part of a project in Missoula where we went door to door asking people their opinion about infrastructure improvement in Missoula. It was a lot of work on the ground, just, you know, knocking on doors, asking people their opinion, writing things down.
Yep.
Getting chased by dogs, getting mean looks from old ladies, that kind of stuff.
Yeah. That's a heavy lift, that kind of work, for sure. I mean, I guess, you know, they're reflecting back on what you shared, Josh, and it sounds like you discussed in your group, there is a real problem I see in program planning where people say that they want to involve the community, they say that they want to involve stakeholders, but they can underestimate the amount of work that is kind of hidden behind those statements, and or the level of engagement, partly because of an underestimation of the practical challenges there, or the insufficient time allocated to the stakeholder engagement part, is it's just a really quite superficial engagement. And so it's more like I've ticked that box, you know, like I did the stakeholder bit, moving on to step 6 or whatever. And that is a common pitfall, I would say. So you're definitely not alone in recognizing that challenge. But I guess for me, the thing that I've learned is that every time I've shorted step 5, I've paid for it in the end. So I do think it's worth putting the time in there and allocating in the program planning cycle, allocating the amount of time and actually budget, both a time budget and a fiscal budget for those kinds of activities. Really do think it pays dividends. But as you say, it is definitely one of the more challenging parts. It's not just a thought exercise. And those conversations can be, you know, they can be challenging conversations. So the other thing that I wanted to highlight is that something you said, Josh, just to go back to that, is that what your program is focused on isn't always, if you have selected it because an RFP came down the pike or because it's just something you think is interesting, that doesn't mean it's going to be a priority for your stakeholders. And so that kind of underlines the importance of maybe moving your stakeholder analysis up in your process. Because if you choose a program that you want to put all of your passions and your time and your budget into, that the program ends up not being a priority for the people that you think you're going to affect, then that is a recipe for a failure, a program failure. And you can't get people to buy into stuff that they're not that interested in. Either they're not personally interested in it, or their job has made it so that they can't be interested in it because their job and their boss has set other priorities for them. So that's why I think the stakeholder analysis is so important, and really taking the time to think through what are the main goals of people I work with or want to work with in my community, and how can I match the existing RFPs or the existing programs that are coming through the CDC or the state health infrastructure. How can I match up those things with what the stakeholders want and need so that they can win and we can win? Otherwise, it's just an uphill battle. Just to give an example, like I said before, I'm really into diarrheal disease and the social and behavioral economics of helping people on the program planning and program implementation side, and on the end user side, understand why anybody would ever engage in a program like this, what kinds of behavioral changes we can reasonably expect on the ground, how can we make that seem attractive to people. I put years of my work and energy and passion into programs having to do with this sector in global health, when in reality, the problem that the community, one of the communities in particular that I was working with, the main problem that they had and that they were starved for assistance with was alcoholism. They had uncontrolled alcoholism. They didn't know what to do about it. This is in one of the remote Nepalese villages I'm talking about, just over the border from China. A huge influx of very cheap Chinese vodka, which was cheaper than a Coke at that time, and no community internal capacity to deal with it. Along comes Kimber and all of her cadre from Kathmandu with their diarrheal disease program. People were just like, that's great, but we have this other problem. And I'm like, well, I have funding for this other problem. And so I really wish, this is just one example of many mistakes I have made over the years of where I started with I just started in the wrong place. Was it a needful place? 100%. Was it the place that community needed at that time? No, it wasn't. And it really impeded progress. So I really appreciate that you brought that up, Josh. Thank you. I feel like we might have had one more.
We have two more.
Two more, okay. Room 4.
Room 4 was Dawn, Ellie, Chris, and Maddie.
Who's your spokesperson?
We did not identify one, but I noticed Maddie was taking notes, so maybe she can.
You elect her.
I elect her.
Maddie, would you be so kind?
Next time, I promise.
We talked about for Cascade County, Ellie and I are in Cascade County, and Dawn is with the environmental health there in Helena State. For us in Cascade County, benefits are pediatric providers and OBGYN.
Yeah.
Ellie and I work at the county health department, and I think we're both in the family services division. And our goal is, she's in the PAT program, Parents as Teachers.
Yeah.
I'm fairly new to all of these programs. And I work in the WIC program. So benefits was one because it's huge in this area. Our community, child and family services. And then we actually did touch on funding sources because you got to have money.
Yeah.
So USDA, the state, that's kind of what we chatted about.
So your funders as key stakeholders.
Yes.
Yeah, good. Yeah, I feel like I probably should have added that to the poll as a choice. That and federal partners, like Trina's group brought up.
Because Dawn did say she had, they get funding from CDC for some of their programs that they're doing.
Yeah. And Dawn, how much oversight are you getting from CDC as a kind of a stakeholder, would you say?
Yeah, so, really, so our program is sort of divided into two sub-programs. One is the site assessment program, which we provide technical assistance and health consultation for hazardous waste sites like Superfund sites. Also state sites, there's federal and then there's state. And then we also have a Choose Safe Places for early care, childcare, and early education facilities. And so we work directly with ATSDR, which is the Agency for Toxic Substances and Disease Registry out of CDC, and they provide the full funding for our program. There's 3 of us. And we're in communication with them pretty regularly. They have a whole team at ATSDR that if there are any projects that are coming down the pipeline, then they might hand it over to us. We ask them technical questions. We're basically their local mini ATSDR for the state, because they have the headquarters and they have regional, but there's so much work that they have a cooperative partner grant program, and I think there's 25 or 28 states that receive funding right now to conduct site assessments, to provide technical assistance, both to our local and regional partners, which would be the health departments in particular. Citizens can call in and we provide direct technical assistance to them. All the different state partners, Department of Environmental Quality, Food, Consumer, and Safety section. So as we came out of the break room, I realized how many, stakeholders and partners we actually have.
Yeah,
so
sounds like a lot. And are you also in Cascade County?
I'm in Yellowstone County.
Oh, you are, okay.
I work remotely, so my program is based out of Helena at DPHHS.
I see, okay.
Yeah.
Thank you. And room 5, who was in there,
Room 5 was Jancy, Mary, Marilyn, Scarlett, and Stephanie. And Mary, I see you on your camera. You should bring up what you put in the chat.
Oh, okay. I just said in the chat, we're with COVID-19, a really important stakeholder group are business owners and business leaders.
Oh yeah.
That wasn't on the list.
That's a great ad.
But I want to say we didn't really appoint a spokesperson, but Marilyn, who's in the group, had 2 really great points about how she connects stakeholder analysis to her communication plan, and also the role she plays in connecting people to resources and other programs.
Great.
And Marilyn, I'd love it if you would share those 2 things.
Oh, thanks, Mari. I'm Marilyn Trevino, and I was late to the party today, and I apologize about that. I had a veterinarian appointment that came early but late. So in the meeting that we had, we were batting around, like what we were going to say as far as who stakeholders would be, and then I just brought up that a lot of times I pull my content together if I'm leading, and I do a good concept model of what the problem is and how I want to see it go. And then what I do is as I put out my stakeholders, I have a small team and then have other informed teams that come at a level so that I'm going to connect with them at different times. So that I pull those stakeholders in at the proper time so that they're not, we're not wasting time and we're not overburdening them.
Yeah.
However, but that we're thinking about every stakeholder that, like if we were going to procurement, we would want to make sure that that stakeholder was brought in at the right time so that we didn't get all the way almost done with the project and procurement kills it. So, so that was where I was kind of thinking where I tie my concept and the kind of the map plan out. I list out all my possible stakeholders. And I think that JC had a good point that a lot of times they really drill down and their group gets really small, but it sounds as though they know who all the other stakeholders are. And that's really important because you just have to think of everybody. I really like the point that was brought up earlier when you're talking about going out to the community and asking for their input. And I think that there's missing players like churches and different community groups that we should also be looking at to maybe get in at different times, or at least making sure they're in our communication so they know what we've done. So it's not like this big surprise when you get it finally finished. And then in the end, my role at Public Health and Safety Division here in the state of Montana is that I am the performance management and quality improvement. I manage the management of it. I don't know how to say that. Colin, you might have to help me. And then also I am the information systems coordinator. And so I help people with getting the right softwares and tools into their program or into their innovative ideas. And that's usually what I do. So I'm always there for whoever needs the help, and I support all the counties and local and tribal counties and everybody, whoever needs it.
Thanks, Marilyn. You wear a lot of hats. All right. Well, I think that takes us into step 6. So we are about halfway through our 10 steps that I wanted to cover today. And so this next step is the SWOT analysis. And this acronym is probably familiar to most folks on the call. But just to quickly review, what it stands for is strengths, weaknesses, opportunities, and threats. And I think it's a really useful way of thinking through and highlighting some of the things that Marilyn just talked about, and Josh and other people who chimed in from the groups. And you know, when you think about strengths, positive internal attributes, weaknesses, negative internal attributes on the team, opportunities, external factors that could improve the program team's prospects, and then threats, external factors that could undermine the program team's prospects. And so a SWOT analysis really builds right into a scrutiny of assumptions, which I referenced previously, and I will return to that because that is one of the final steps in the log frame process. So again, the steps that we've done so far have included defining the problem, conducting a needs assessment, developing a mission statement, identifying stakeholders and understanding their aims, and now the SWOT analysis. So the purpose here is to assess the performance and capacity of the participating units and divisions of organization. And really, ideally, each participating unit would undertake a SWOT analysis together with the program planner, facilitating that discussion. And so it's a tool that's used in a lot of different institutions, partly as an appraisal tool, but also partly as a brainstorming exercise, in which hopefully there's full participation. And so returning to our COVID-19 testing case, which I've mistakenly referred to as COVID-10. So I've gone back in history here somehow, but this should be COVID-19 SWOT analysis. So what strengths exist locally, like in our community here in the Missoula Valley in Western Montana? Of course, we have some of the players that have been identified in the previous conversation, and each of which has its strengths and brings it to the table. So in addition to some of the usual suspects, DPHHS, city, county, local, tribal health, we also have Rocky Mountain Biological Lab, Rocky Mountain Biological, which is a separate company that was involved early in the development of testing capacity, the Montana University system. Of course, there's a lot of public interest and public cooperation. So those are strengths that you could see could be all brought to the table in a COVID-19 testing effort. There are lots of weaknesses that I'm sure I don't have to point out to this group, but chief among them are coordination and messaging. But there are opportunities like linking together the strengths listed above, business growth for local businesses that have engaged in different ways with the COVID testing, development of a COVID testing capacity in our community. Now we're phasing obviously into the COVID vaccination phase. And another opportunity is that these kinds of partnerships give us in our Western Montana, Missoula Valley community, the ability to look ahead to prevent future disruption, because when you have conversations across all of these kinds of stakeholders with the different strengths that they bring in and the different perspectives, it means that you can future forecast way more effectively than if you're attempting to do that with a smaller team that's just you and your folks in your office. And then the threats analysis, again, probably don't need to be overstated here because everybody's familiar. But clearly economic ones, funding it, supply chain disruptions, and misinformation or disinformation. This brings me to step 7, which is the theory of change step or logic model or problem tree. Well, these are really parts of the development of the theory of change or logic model. So a lot of times when I think about program planning and evaluation as two sides of the same coin, which is the development, implementation, and analysis of a public health program, you will see the theory of change being used in part 1, which is planning, as well as part 2, which is evaluation. So for me, step 7 is really a bridge step that carries you from the planning stage over into the evaluation stage. So I want to talk at some length about the theory of change approach. So the purpose of this stage is to identify major problems and that you're focusing on, and what are their main causal relationships. So when you're developing a theory of change, your job is to make a statement about what is your idea about the problem that you think you're going to be solving in your program, and why do you think your program or your project or your initiative is going to have an effect on that problem that you're trying to resolve. And so oftentimes we see a lot of misattribution, especially with bigger and more complex problems. Like for instance, we see a lot of anti-malaria programs in the developing world. And so people might come naively into the fight against malaria, and they might say, well, I would like to address this problem by developing a mosquito net distribution program. And then there is a shift in malaria rates. And in real life, there is no connection between your malaria or your mosquito bed net program and the shift in malaria rates. The shift happened because of something else. I'm going to come back to that when I talk about evaluation. But the point I'm making here is that you have to be careful that the causal shift that you're imagining isn't purely imaginative, that any changes in moving the dial on the health problem that you are focused on is truly attributable to the program that you have designed. So one of the outputs of this stage of LogFrame is the problem tree, and the problem tree identifies the causes and the effects in your thinking. And so working through this with your team is really important so that you know that that the connections are mutually understood by all team members and that they make sense to all team members. And so say, for instance, we start down here at the cause, and I see I've mistakenly capitalized Corona here in my, or maybe my autocorrect jumped in and thought I was talking about the beer. But so say the cause of the problem down here is we have insufficient testing for the population size as one cause in the problem that we're trying to resolve or address. And the other one is people simply don't know that they are infectious. What that leads into is a situation where Montanans are unwittingly infecting one another. And the effect is that more Montanans are falling ill with COVID-19. And so this is one way of setting up what's called a problem tree, where you've got the roots, which are the root causes. They lead into a sort of a midstream effect, which then results in a late stream effect. a problem tree helps us conceptualize the relationships between what we think the components of the problem are and how they feed into each other. And it's a really useful thought exercise to do with your team so that you begin to delineate what are the components and where do they kind of fall on the schematic? Are they root? Are they midstream? Are they late stream? And then that allows you to start thinking very concretely about where you want to focus your efforts. Another way of understanding this is by developing a schematic like this, where you start out with a description of what your inputs are. And so this is here on this slide. This is a logic model that I developed for a grant that we were putting together recently on campus here. And so the idea behind this grant was that we were appealing to the philanthropic arm of Blue Cross Blue Shield and hoping that they would provide funding for support for statewide mental and behavioral health baseline study, integrated behavioral health clinical training in rural and tribal locations, social determinants of health education occurring in schools in rural and tribal locations, and also activities that would influence the policy landscape that was relevant to rural and tribal communities. These were the inputs that we were hoping for. We thought that this would lead to, this was our logic, a couple of different things. One was a statewide centralized public health network formed to facilitate collaborations and also develop state-of-the-art knowledge about factors affecting behaviors and mental health outcomes. First. Second would be individuals obtaining mental and behavioral health support, including compassionate wraparound care by trained clinicians across our state. Meanwhile, we thought that training about the social determinants of behavioral and mental health outcomes would be occurring in the schools, and discussions would be developing with health policy decision makers in rural and tribal locations. The combination of inputs from the funder would lead to these activities, which would be undertaken while this thought bubble and that thought bubble were happening. And this would enable this thought bubble over here, which would be community-wide changes in attitudes and behaviors toward and about mental health, and increasing awareness of the integrated behavioral health approach. This would lead to reductions in social stigma about integrated mental health care and mental and behavioral health challenges, an increased awareness of the importance of the integrated behavioral health approach to addressing mental health problems, increased mental and behavioral health outcome, or improved mental and behavioral health outcomes, and decreased healthcare costs overall in the long run. And so developing a schematic like this can be kind of fun, actually. I quite like it. You sit down with your team members and you just kind of walk your way through, okay, if we have, what are we thinking here? Like, what would the inputs be? What would they be in the, what would they be what would be the circumstances that they would be happening in? What would that enable, and what would the outcomes be? And so this kind of exercise can be very fruitful for elucidating on your team, what are you guys thinking about in your program planning? Like, what happens first and how it would affect other parts? Now, the log freight matrix for COVID-19 testing that I developed would be here, and it just fills in that 4x4 matrix that I talked about previously, and helps this log frame matrix, or 4x4 matrix, comes right into the elaboration of the logic model, and also stating what your theory of change is. One time I told my counterparts in Uganda that we were going to have a theory of change workshop. And one of my colleagues rolled his eyes and he goes, "Oh no, not more theory," thinking I was going to come in and teach like a theory. But that's not what theory of change is. Theory of change is what is you, Marilyn? What is Marilyn's theory about the change that her program is going to affect on the ground among the end users of her program? And so the log frame matrix really helps start the thinking about that theory of change and how the inputs relate to the outputs through the assumptions, and how those outputs govern the impact on the project purpose and the goal, ultimately the goal. So this is, like I said before, we read these matrices from bottom to top. The inputs are like the widgets, the bits and bobs that are paid for by the funding and implemented on the ground. In the case of COVID-19 testing, that might be things like test kits, labor, travel. Next column over, as I said before, you want your objectively verifiable indicator. So if those are your inputs, then these are some indicators that you can measure, and those measurements help you track the execution of your project. The means of verification, you want to say exactly like where are you going to verify? Where are you going to get the data for those indicators? Okay, in this case, the data is collected at the test sites. Data about how many COVID tests were used in how many sites. Now, an assumption here is that people come. So what we can then see is that if you connect, as I did on that previous slide where I showed a mock-up of a log frame matrix, if you have your inputs of test kits, labor, and travel, and the assumption is met that people actually come to your testing site, then you can get this output, which is that you actually ran some tests, some testing on the prevalence of COVID-19 in your community. Your objectively verifiable indicator would be your test results. You get those test results from data collected from test lab. You assume that those tests are accurate. That leads you to your project purpose, which is improvement in the knowledge of spread of the virus. And then you can walk your way across the columns again. And then that jumps you up to your ultimate goal, which is sort of like the 10,000-foot view. It's your outcome. A lot of times people confuse the nomenclature between an output and an outcome, and that's very common. Outputs are way down here, and those are still sort of your widget level, your bits and bobs of things that are getting done on the ground. Your outcome, which is also sometimes called your goal, is how have you moved the dial on this particular health problem. So it's like I said before, it's like the 10,000-foot view. Inputs are like the 5-foot view. Outputs are like the 20-foot view on the project. And so you can work your way across the columns here and see how it all fits together. And this is just a hypothetical mock-up that I came up with to just exemplify some of these ideas. But you obviously would fill this in totally differently depending on what program you were planning. Okay, that brings us to our second poll. And I'm just curious to know, have you used a theory of change or logic model approach in any of your program planning or reporting so far? So if you could just inform the rest of the group, like where are you on this? So how many of you guys have not used this before? And how many are actively using or have used it? So it looks like we've pretty much got everybody voting here. So I see that roughly twice the number of people have used log frame already, which is great because that's going to inform the discussion in our second breakout room. So we're going to do a super quick breakout room next. And in this breakout room, I'm going to ask you to discuss your experience with or view of the theory of change or logic model approach. And I want to hear from you through your spokesperson for your group, what are the strengths and weaknesses of the approach in your experience? Now, I will say that some people don't like log frame, and some people call it lock frame, not log frame, because they think that it locks you into a particular set of steps. And I understand that criticism, and I do see that log frame can function as a lock frame because people fail to use it in an iterative way. They fail to come back and make mid-course corrections. I think one thing that is imperative in making a log frame work is that you just have to you have to work the model multiple times over the course of the grant period, because like I said before, circumstances change. You lose staff, someone gets sick or retires or takes another position, or an administration changes, or there's a pandemic. And so that would be my counter to people who call it lock frame. But that's just a little bit glib, you know, like lock frame, oh, that's funny. There may be other substantive criticisms of log frame that you would like to bring to the conversation and report back to the group. And so that's the subject of this conversation. So we'll put you in this breakout room, same breakout rooms.
Yeah, there'll be one switch because we had a room that had very few.
That's a good idea. So maybe
someone might have been launched into another group. How long would you like these set for?
Let's do 7 minutes again. Thank you, Emily. Okay, well, let's hear back. So what we could start with group 1, which I think is Trina and Colin, and other people whose names I didn't catch the first time through. Who's your spokesperson this time?
I'll kick us off, and then there was really good points made by everyone in the group, so they can kind of jump in and share some of those. But I tried to write down a few of the things we mentioned. So we talked about log frames being a really good roadmap if you stick to it, and they really force you to think logically. Someone mentioned that it kind of kills creativity, so that was kind of it could be a strength or a weakness depending on what your needs are, I guess. But yeah, it's really a way of thinking that you need to train your brain to kind of think that way. I think that's kind of how Melinda described it. And if the weakness of it is if you kind of just build it and leave it there and don't keep coming back to it, it stops becoming an iterative process. And so you kind of like forget that it's there, or kind of parts of it become obsolete and just kind of ineffective, I guess. And I'll let some of the other people in our group jump in and kind of build on that.
Thanks, Colin. Anybody else want to jump in?
Colin mentioned that this kind of framework can block local people from participating in the process of the creation of the model, and then things become cumbersome. Did I get that right, Colin?
Yeah, that's true. In my experience with previous jobs and on large international projects, the planners kind of took over and kind of laid everything out, but it wasn't, they didn't really engage possible partners or local stakeholders to get their inputs. So it was kind of a top-down approach and a little bit disconnected in my opinion.
Yeah, I think that results in my experience from people not recognizing all 10 steps. They just want to cut straight to the matrix or the problem tree and call it good. So yes, remember the 10 steps. And maybe we could go on to, with thanks to group 1, group 2. And Leslie, or Emily, I think that was Leslie and Marcia, but they would have gotten combined probably.
And then Patricia and Stephanie. Stephanie got bumped with them.
What'd you guys come up with?
I was taking notes, so I can briefly explain. So one of the things we noted as weakness was keeping it updated as things may change. Like you might write a grant and create a logic model, but then as you're implementing the project, you realize things might have changed. But it also sets really clear guidelines for things that you don't want to change. Like one of us uses logic models for accreditation, and it was just like a very clear tool. It was noted that, and Bailey, you might have to chime in more on this because I don't work in your program, but just that she has to toggle between two different programs and it may not fit the both of the programs, the logic model that they're using or being asked to use. Everybody said nobody was familiar with the log frame model, but just used a basic input output and usually with writing grants. And then just the question came up of like, how do you make it more of a living document and use it every day? A lot of us are like involved in the grant writing process, but not necessarily the implementation. And then we're involved in the reporting process, but everything in between, making sure that the logic model was like a focus in the implementation. And then it was also mentioned someone was working in continuous quality improvement, and it helped keep them on track and stay focused on the measurables, but just keeping it updated to what changes are happening in the program was just labor intensive and time consuming.
Yeah, those are such good points. And I think that for me, when I hear you talking through them, it just brings you back to the stakeholders. Because like if you do your program planning and your grant proposal together with your implementers and other stakeholders having a moment to chime in at a minimum, and then you build into the grant proposal document and your program planning documents, the fact that you're going to revisit on this schedule and you're going to refine it, you know, according to how circumstances around the work have changed or are changing on the ground, I think you can ward off some of those problems that you've described at the past, but those are really real problems, Stephanie. So thanks for bringing them up. And I really connect especially to how difficult it can be when you have your planning and reporting team be totally different from your implementers. And that just that space that opens up there can be a tough one. Those are really good points. And then, so thank you. And then I'm going to go over to group 3, which I think was Ethan, Josh, Molly, and Erica. What did you guys come up with? Any other positives or negatives, strengths, weaknesses?
Oh, Ethan, if you want to go for it, you can.
No, go ahead. I'll start.
A couple of things we talked about is these frameworks feeling a little too linear and like wanting something that allows for iterativeness. I know you mentioned that you can always go back, but I think we were having a hard time that we saw some limitations in this framework, not necessarily like building that in from the beginning, that things are going to be iterative.
Yeah.
And then we talked about how for certain types of programs or interventions, it can be really difficult to measure outcomes. Like in my world, teen dating violence, like we definitely utilize things like the youth behavior risk behavior. YRBS, the YRBS data, but we can't necessarily demonstrate that like our programming was the thing that led to YRBS data changing. And so it's really easy for us to come up with our outputs, and we can kind of like theoretically say what we think the outcomes are going to be. But then when we get to the evaluation stage, it's really difficult for us to demonstrate that we heard the impact.
Yeah, that's a big problem. And I'll come back to that in a bit, probably next hour, but that's a perennial challenge for sure. Thanks for highlighting that. Anybody else from your group want to come in here? Maybe move on to the next group then, which would be, I think Dawn, Ellie, Chris, and Maddie. Did I get that right? Emily?
Yeah, we've got Amy, Dawn, and Maddie.
We discussed with Dawn's program that their funding source kind of made them do a logic model, but they're kind of stuck. They don't know how then it translates, like you said, down the tree to being in the field and helping people. How does that work, you know, day to day? And it was really strict, must do's. And they've only really seen the planning stage. So our new person in our group said, Amy said the same thing. In the WIC program, we've used more theory of change and the stages of change leading towards participant-centered education. And I was just sharing with my group that that is a progression that came from the federal level down to the state level, down to the local levels, and how it's taken probably 20 years for that progression to actually get to client level and staff level. And you have to remember to revisit it too and re-educate your staff so that they remember. And, so, when you get down to that bottom spot, the re-education of staff and the learning, like you're teaching us, that it's ever evolving. And you learn more things as everybody goes through a logic model or a theory of behavior. And to remember to re-educate staff and your stakeholders all the way back up.
Yeah, that's such a great point. And I mean, one of the reasons why I like to show people the pre-seed and proceed models and that RAND model, getting to outcomes, is because, I mean, my favorite thing to see in a grant is where people are saying, well, we're going to combine elements of pre-seed with a log frame approach. And we're going to use the RAND getting to outcomes thing. And this is how we're going to make log frame more iterative, how we're going to make it improve what log frame makes available to us, and that kind of thing. So I think that regular learning and getting reminded of what's out there can be really good. And I say that like understanding at the same time that log frame, better or worse, still like central. That's what CDC wants you to use and things like that. But I think you can come in the side door with some of these augmenting perspectives, like those other three I showed you at the beginning. And for folks who join the call late, which is totally acceptable, people come in, they come out, they have other meetings, what have you. Just a reminder that we are sharing all the slides with participants, and those are ever available. If you want to just ping us by email or ping Emily, we'll get those out to you. I think there was one more group then. Is that right, Emily?
Yep, Jancy and Mari, Marilyn and Scarlett.
Who's your spokesperson?
I think I was voted. So we talked about how the two frameworks can benefit you in the process. So both Marilyn and I were talking about how the kind of mind map bubble logic bubble model helps you initially just get your group and your program, your ideas together, like conceptualize what's kind of in your brain and put it down on something physical. So just even if you were like in a big group and you had sticky notes, that you're placing all over, and then make that a little more concrete until the point where you get kind of a more concrete map. So that really helps you visualize your stakeholders for your program. And then secondly, the log model, the more everyone's kind of saying the more rigid model, by doing the other first, maybe that could help you to get that more kind of concrete model down, which is from my experience, something that you have to contend with if you're doing any type of federal grant funded programs. Our program in particular is federally grant funded. And just in case anyone else is unaware or pursuing a federally grant funded program, just a little reassurance, they actually will provide you with frameworks. They'll provide you with a sample logic models. So, don't be totally freaked out, because if you are having a hard time coming up with something, or you just need that kind of kickstart, they will provide that for you. So that is really helpful. And then of course you can change it and modify it to how it works for you. And for ours in particular, we had short-term and long-term outcomes, which is helpful. And then I also just wanted to mention, you are correct about the mid-course correction. So for example, in our program initially, and I came in after the program was already funded, so someone else had already kind of done the pre-work. But when I came in, we actually had an immediate mid-course correction where we went from a mandatory requirement for the program to a voluntary approach. So actually experienced that right off the bat. And I will say that I kind of wish I'd had this course like my first week of starting, because it would have really helped me with our program and also with our reporting. We do our own reporting, which is good because then we are involved with that, reviewing our progress and completing our progress reports. And so we actually do look at that model and we update it, just like we did with the changing it from mandatory to voluntary. So we actually had to go in and change, you know, that part of our model. So
yeah, that's a really interesting observation and good experience that you brought forward there about that mid-course correction. And in my experience, I don't know how it is with you all and your funders, but it seems to me anymore, if you have, especially HRSA funding, SAMHSA, and a little bit NIH, is you're going to get assigned some technical advisors that are going to help you work through these processes, and they're very hands-on. And so I love how you put it, Scarlett, about you can get a kickstart where you can get models, like you can take them out of this presentation, but you might get it from your technical advisor that's been assigned to you by your funding agency. And yeah, the process has become so much more streamlined from when I started, and where you were like just doing everything from scratch. And I really appreciate what you said there, Scarlett, because I don't know about you guys, but for me, it's a lot easier to start with modifying someone else's framework than just looking at a blank piece of paper. So thanks for those perspectives, you guys. Now we have one more discussion in here, which is going to be a briefer one. And that's coming up in the next hour. And I'm gonna talk a little bit more here, and then we're gonna break and then have one more discussion. I would presage that discussion though. And it is about what issues, if any, affect any hesitation you might have about choosing and defining indicators or metrics for program planning. And I'm going to be talking about indicators and metrics next, in between now and that poll. But what I'm going to ask you guys to do in that discussion room is talk with yourselves and then come back to us either in the chat box or if we have time in like this kind of forum. Do you have research design uncertainty? Do you have staffing challenges relating to evaluation? Do you have worries about time or the skill set required for managing data sets or analysis? And the reason I want to find that out is just to kind of help take your temperature as public health practitioners. And that will help us refine the offerings further that we have through our public health training center. And so just know that we're going to come back to that in a little bit here. So we're coming up on 10:45. So I just want to be mindful of the time. We have a little more than an hour left.